would be recorded that the world's largest Ebola outbreak to date started in 2014 in Guinea and continued till 2016, spreading into neighboring Liberia, Sierra Leone, and other countries in Africa. More than 28,000 people were infected, and more than 11,000 of them died of it. Nigeria had a share of it. Now you remember Patrick Sawyer. Yes, he imported the disease into the country. Now, after a bit of relief, the recent resurgence of Ebola on the continent has been a huge concern to many countries in Africa, including Nigeria, especially at this time when many countries of the world are still battling with coronavirus pandemic. The World Health Organization WHO, says it is working with health authorities in Liberia and Sierra Leone to increase surveillance in border districts as well as improving the capacity to test for new cases. The Nigeria Center for Disease Control, NCDC, also says as part of measures to control the spread of the virus into Nigeria, they will continue to monitor the situation and initiate preparedness activities across the country if the need arises. However, experts are still concerned on the level of this preparedness in Nigeria and public awareness of the risk of the disease if it were to spread into the country. Now, what then should be done to prevent the virus from spreading into Nigeria? What measures are on ground to prevent and mitigate the impact of potential Ebola virus outbreak in Nigeria? These and more are some of the issues that we'll be finding answers to on the program Nigeria Today shortly. Welcome to the program Nigeria Today. Is live on NTA News 24. I am Musbal and Wahab. Now, with me in the studio to discuss Ebola and prevention is our public health physician, Dr. Emmanuel Okpetu. Very welcome, Dr. Okpetu.
Yeah, thank you.
Now, also in the studio is head of Risk Communications Division of Nigeria Center for Disease Control, NCDC, Dr. Yahya Disu. Glad to have you, Doctor.
Thank you for having me.
All right, so Dr. Okpetu, it's been a while since many people last heard about Ebola in this part of the world. Let's refresh the memories. What about Ebola virus? How does it manifest?
Yeah, thank you, Musba. So, Ebola virus disease is one of the viral hemorrhagic fevers. So, it's a virus. It could lead to bleeding sometimes, and it's a fever, as the name says. And so it manifests with fever, body pains, headache, fatigue, and basically the symptoms are symptoms that you may find difficult to differentiate from other causes of fever. But because it could be associated with bleeding from different parts of the body, different body openings, that is why it is classified as a hemorrhagic fever. Though people may get sick with it without having the bleeding, but because it could lead to the bleeding, we need to consciously call it a hemorrhagic fever, similar to what may be more familiar with us in our own environment, Nigeria, Lassa fever.
Yeah, thank you very much for that foundation you have created. I'm still staying with you. You've said it, there is two-headed fever and then viral disease like COVID-19. Any connection between Ebola and COVID-19? Similarities or differences?
Yes. So Ebola and COVID-19, they are all caused by viruses, but there are different kinds of viruses.
All right.
And then Ebola, like I said, is a viral hemorrhagic fever, whereas COVID-19 is a respiratory virus. So that's why when you look at both of them, they may have similar symptoms, but because of the type of virus and what they cause in the body, the organs they primarily attack, they have some differences. However, apart from the fact that some of the symptoms are very similar, the mode of transmission have some differences and some similarities. So the mode of transmission may also, there may be some modes of transmission that can be prevented by the same strategies of prevention.
Okay, you've talked about the mode of transmission, but you've not really told us about how they transmit. Can you establish that further?
Good. So for Ebola, which is the key, our key topic for today, Ebola virus is being a viral hemorrhagic fever. It's transmitted from person to person, basically. So what that means is that human contact is primarily the way it is transmitted. However, this human contact has to do with fluids, body fluids. Okay. When body fluids of somebody that is infected comes into contact with an opening, what we call epithelial opening, skin, like skin that is opened, the mouth, the nose, that can receive what the person, what I will call the fluids from the person that is infected. It could also be sexually transmitted. If somebody has unprotected sex with somebody that is infected, and sometimes, usually because of close contact, sneezing could also transmit it to somebody that is, if it's less than 1 meter usually. But typically, the person has to get into contact with the body fluids of somebody that is infected.
Okay, thank you very much, Dr. Okpechu. Now, Dr. Disu, what is the fate of those currently infected with COVID-19? Are they at a greater risk of contracting it, the Ebola virus now?
Essentially, everybody is at the same risk of contracting Ebola virus, whether you have COVID-19 or not. Because you have COVID-19 does not put you at greater risk of getting this Ebola. All it takes is exposure to somebody who is infected with the disease, especially the bodily fluids that may be contaminated. And then once it gets into, just like Dr. Okpechu said, my colleague, once you have an opening on your skin, maybe like bruises or cuts, and this gets into that place and somebody can get that. So that's so you don't necessarily have a higher risk because you have COVID-19. Unless if, when we talk about severity of manifestation of this disease, of course, for COVID-19, we have certain categories of people above 50 years of age that are more likely to suffer more severity or death from it. But Ebola, from the experience, it attacks all age groups, as in the severity is almost the same thing because case fatality is very high in Ebola. So we can't really say in younger age group the case fatality is lower. No, it's not like that for Ebola. Once you are exposed, because the viral is very viral, as how do I put it now, and it can multiply very fast and is more dangerous than COVID-19.
Okay, can manifest or multiply so fast that, like you said, more dangerous than COVID-19. But when we had Ebola, I think, for some years on the continent, and now just a few months after COVID-19 came on and ravaging the world, we've been able to find a solution to that. We currently looking at how to import vaccines into this country now. We'll talk about that subsequently in the course of the program. But those who have already been treated of Ebola, what is their chance or chances again of contracting Ebola? Are they still susceptible to contracting it?
When it comes to getting infected, it's a matter of getting exposed to the virus. Okay. Anybody, irrespective of whether you've had the disease before, once you are exposed, the virus can come into your body. But your immunity, that is your ability for you to respond, to react quickly, is based on the experience your body has, as in terms of previous exposures to the virus. So for those who have had Ebola, even we don't know for those who have been exposed in 2017, how long after that they can still be protected from the virus because of their previous exposure. But the issue is we don't take things for granted, and don't say because you were exposed before and you can no longer get the virus again. And after all, when we had Ebola in Nigeria, the highest number of cases reported was about 20. I think we have about 8 deaths. So even you cannot even be sure where those 12 people are in the country now. Some of them may be old, some of them may be out of the country. So it's as good as saying we don't have any level of immunity compared to the millions, or over 200 millions of people that we have in Nigeria.
All right, no level of immunity. You just have to continue to prevent yourself from contracting Ebola. Now, Dr. Okwetu, can you please remind us again of how to prevent this virus from entering the body system?
Okay, so just to reiterate that the way you get this is through blood and body fluids.
Okay.
So basically, if you want to prevent it, you have to prevent blood and body fluids from getting in contact with you. So that's what we call universal precaution. One of the things that is good about, well, I say good, but in terms of what we are doing to prevent COVID-19, a lot of those measures are very, very important in preventing Ebola. The hand hygiene, using soap and running water to wash your hands, or use hand sanitizer when there is no water. Those basic hygiene practices are very, very important. And of course, staying away from not sharing sharp objects, because this is a blood-borne disease. Okay. So not sharing sharp objects in the case of Ebola is very, very important. Then for health workers too, health workers need to be very conscious of their universal precautions measures. So they will ensure that they use gloves when they need to use gloves, they wash their hands in between care of patients, and they ensure that they dispose sharps appropriately. And of course, in the community too, the way we dispose of sharp waste is also very important. So these basic hygiene measures that we are being told to do with COVID are also very applicable to Ebola.
All right, thank you very much, Dr. Okwetu Emmanuel. Let's quickly take a break. We'll still have a lot to cover on this issue of Ebola prevention in Nigeria. We'll be back in just a moment. Thanks a lot for staying with us on Nigeria today, and we're discussing Ebola prevention in Nigeria. And I still have our public health physician, Dr. Emmanuel Okwetu, in the studio, as well as Head of Risk Communications Division at Nigeria Center for Disease Control, Dr. Yahya Disu. Now, Dr. Disu, when coronavirus came, the second wave came in and went. Now, second wave of coronavirus came with another strain that we call the one UK strain. Now, what are we facing when it comes to Ebola this time around? Is it the old strain of Ebola or a new one?
Well, we have about 5 strains of Ebola that have been identified so far. And the ones that we experienced in the West African sub-region about 5 years ago, and was the ones that was identified in Guinea was the one that was eventually exported from Liberia to Nigeria. That was what we found in the West African sub-region. I think that is still the strain now that is still that is still predominant around. So, but what is important is whichever strain it is Ebola.
Right.
We need to be very, very careful, and we need to take the necessary precautions because the case fatality is very high, and we cannot afford to lose anyone, whether old or whether young, irrespective of gender, religion, and we all need to come together to fight them. By the time you are getting infected, you don't know which strain you are even getting infected with, but the universal precautions that you have to take are still the same against all the strains, and which has to do with washing our hands regularly, and then ensuring that particularly if anybody is traveling from that country where confirmed cases have been reported, and then we need to be extra vigilant and then find out whether they are in contact with somebody who is sick, and they are supposed to stay at home for like 21 days, and they need to report to the health authorities so that they can monitor them. If after 21 days they don't show any symptom, then that means they are free of the virus. That's one thing about Ebola. And then you can only do this in conjunction with the cooperation of the health authorities. And then we people in the environment needs to be very careful too. And then when people are sick, and that is not the time we want to touch, and we want to make sure that we wash our hands and we maintain the physical distancing. A lot of lessons from COVID-19 and it's going to come into play now. Physical distancing, hand hygiene, and then also, of course, Ebola has nothing really to do with the use of face masks because it's not a respiratory illness. But then, because Ebola virus is transmitted in bodily fluids, so saliva coming out from somebody, or if somebody is sneezing, if that person has Ebola, is also likely to sneeze and contaminate the environment. So the use of face masks may also still be helpful. So if we just abide by this protocol, the likelihood that we could get Ebola is reduced. But more importantly is identifying those who are sick and ensure that we call the 6232, that is the NCDC short code. Once they call that number, and then the healthcare, the agents at the other hand will ask relevant questions, we're able to direct them to the appropriate place and guide them on what to do with regards to reporting. And
okay,
then
the code again, doctor.
6232.
All right, 6232.
6232. That is the short code for NCDC. If you want on any health-related matters like infectious disease, be it Lassa fever, meningitis, yellow fever, once you call that number, you will get appropriate information that you need, whichever state, wherever you are. Definitely, the states are in charge of responding, but we can communicate with them, and then they will link up with you and then take it up from there. So we also need to be our brother's keepers, and then to make sure that we watch our backs, because somebody might even forget what to do when it comes to. This is not the time we travel to those countries where they have reported confirmed cases of Ebola. If it is not necessary for us to travel, we don't have to travel. We need to stay until there is that announcement that, oh, the coast is clear, and then we can move. And if you have to, then you need to take the necessary precautions. And then we need to listen to the travel advisory. If you go to NCDC website, the public health advisory is out there to guide public health workers, to guide everybody. And then travel advisory is also there. And the signs and symptoms and what you need to see to report and what you need to do where you need to report to. All those things are there. For now, since the reported case in Guinea, Nigeria has conducted a risk assessment. We have been we are at the level of moderate level of risk, and what that means for us is we need to activate our preparedness plan, which Nigeria has already started doing. We already have EOC for us. We have standby team that have been mobilized, that have been trained, that can be deployed at any time in case they said that there is a suspected case everywhere. So all we need to do is to continue to communicate to Nigerians what they need to do, what they need to know, and what they need to understand, so that we all need to work together to fight against this. At the point of entry, because Ebola does not just jump, it has to come in. Most likely, it's going to be by here through the point of entry. That does not mean that we should not take care of our land borders. Then they have scaled up screening activities by the portal officials. They're already using the right tools to screen people that are coming from high-risk countries, and then to be able to recommend appropriate measures based on their findings from the screening. So that one is also ongoing.
All right,
and then the treatment center.
This is good to know that NCDC is preparing for this, and we hope that Ebola will not find its way again into this country. Now, we've not heard about any vaccine for this. Anyone in sight?
Do I come in there?
No, the doctor, this is I'm saying with you.
Yes, there has been vaccine that has been approved. Nigeria is already applying through what you call ICG, and then WHO, they are making promises that Nigeria will be able to access the vaccines that we will require. Of course, the Ebola is not like COVID-19 that you are seeing all over the country. So the technique for this is going to be ring vaccination based on where they have the reported cases, and also the healthcare workers the frontliners who are likely to be exposed to this disease, the contact tracer and all those things. So we will have enough vaccines to be able to immunize or vaccinate people that really need this vaccine.
All right, Dr. Okwetu, what should Nigerians or Nigeria as a country now be doing at this point in time with COVID-19 still raging?
Yeah, so from what Jisoo has said so far, you see, so the NCDC is actually providing a good leadership in terms of giving advisory and providing guidelines on what should be done. But the responsibility goes back to the states, particularly the states that are in the border countries, border communities are their responsibility. So surveillance need to be stepped up under the responsibility of the states, public health departments. And which also means that the local governments in those places need to also be up and doing with their integrated disease surveillance and response activities. The point of entries, like he said, should not just be about the airports. The seaports and the land borders are very important. Travel history becomes very important for persons who may have symptoms that are suggestive. Because, of course, again, this season is the season where we have Lassa fever that have very similar symptoms like Ebola. So we need to step up those surveillance activities. Of course, when somebody is coming from a country like Liberia, Guinea, or anywhere around there, it's a high index of suspicion. And we must also know that it's not only in West Africa. There is also an outbreak in Central Africa, Congo, DR Congo, which is popularly known as Congo Kinshasa. So, which means that basically we have this outbreak potentially in different parts of Africa. So we should not just focus on people coming from Guinea. Right. We should be able to screen everybody irrespective of where you are coming in from in this country, because you don't know where people may have been. And beyond, then health workers need to also step up their index of suspicion to ensure that they ask for different symptoms that may point to this kind of